Hi there, I'm Dr. Stephen Phelan. Welcome to Dental Excellence. And for today's video, I'd like to ask you a question. Have you ever placed a Class 2 composite resin and removed the matrix band system, whether it be a sectional or a Toffelmeier type of band system, and found that there's a fair amount of flash interproximally on the buccal proximal margin or the palatal lingual proximal margin? So basically the matrix band hasn't adapted tightly to your box outline form, and it's caused some flash there, which is fairly difficult to remove. And I found that this was a frustrating part of Class 2 composite resins, but the good news is I have a really simple, inexpensive, as I said, simple, effective solution for you today that I'll share that can eliminate much of this problem. So the solution really revolves around using Teflon tape or plumber's tape, whatever you'd like to call it. They call it thread seal tape. I went to the hardware store and bought some extra packages of this just to show you the packaging, and I'll put up a picture of this at the end of the video. And I'm using this tape as a way to push on the matrix bands and have them adapt better to the tooth form. Because even with the sectional bands, with the rings and the band and the wedge, we can get a good adaptation to the gingival margin, but I found sometimes that the ring will not push the matrix band against the tooth form really well. And then when I burnish the matrix band to get a good contact, my matrix band's not adapted to that box really well, especially the more conservative boxes. So let me show you a picture here. And what I've done in this case is I've basically shoved the Teflon tape, we roll it up, and I push it into the space between the tooth, the opposite tooth, the matrix band, and the ring. And it fills that space, and I condense a plugger into the Teflon tape and really adapt the Teflon tape against the matrix band to push the matrix band tightly against the tooth that I'm preparing and restoring. And this eliminates the gap between the matrix band and the box and the wall beyond the box where you would get flash. Otherwise, you just don't have that adapted not matrix band against that tooth. Sometimes there's like a little gap there, and it often occurs when you start to try and burnish the matrix band against the adjacent tooth to get a great contact, which is the first thing that we really want. A great contact, a great gingival marginal seal, but then I'd also like the great proximal marginal seal, and this is the solution for that. And again, we're just using this plumber's tape. We just cut a little section, probably about this big, roll it up, and I put it into that space. And then I use a plugger, just a composite plugger or a burnisher, and just push that into there. And that closes the space between the tooth and the matrix, the sectional matrix, and really gives me great proximal margins as well as gingival margins, and makes finishing of the restoration much easier. Much easier. And if you look at this case, this patient had a MO that had a lot of flash previously, I would guess, because it had chipped in a couple of places. Now, radiographically, this MO looked good. It looked like there was no caries. I felt around, it felt good. What I told the patient is I'll try to refinish this margin, this marginal ridge, and if I could get a good refinished marginal ridge plus contact, I would leave the restoration, because it was, she told me it was only placed a few years before she came to my office. So it was only in place for a couple of years, maybe 3 years. So I didn't really want to cut it out unless I had to. I just basically refinished it. But that's the problem when you get too much material in there. You end up with an over-contoured restoration, which then can chip and cause problems, or food traps, or all kinds of issues. So that one I was able to reshape. Let me show you another case on a bicuspid. You can see this is a very conservative small slot class 2 type of preparation. And even with a nice premolar ring, I still found that I had an open margin on the palatal proximal area there of that box until I shoved that plumber's tape in there and closed that space. And then I had a great margin. So this is basically the tip for you. I also use this if I have, say, 3 restorations in a row. And the middle restoration, if I have 3 in a row, I'll typically use a Teflon matrix band on. But unless you have something in between the prepared adjacent teeth, it kind of overextends the matrix band just naturally. So I use this, if you look here, I'm using the plumber's tape to give the adaptation of the Toffelmeyer between the class 2s that I'm doing. I'm again placing 4 actually different class 2s with the matrix band on the one that's the kind of MO and DO. And then I use the plumber's tape to contour the matrix band without placing matrix bands on the adjacent teeth. What I end up doing is I'll do the central MO and plus DO. I'll finish it completely, polish it, get perfect marginal shape. And then I go in and do the 2 adjacent class 2 resins with sectionals because I get a better contact with that. And then when I go to do the sectionals, I again use the plumber's tape on the little space on the buccal or lingual between the sectional, the adjacent tooth, and the ring, like I've shown you in the pictures. And if you're wondering how we get the great kind of really conservative shape to our proximal boxes, I use basically sonic instruments, sonic preparation instruments. These are the Kavo Sonic preparation system. If you look, there's the inlay preparation shape, which I find really good for class 2, conservative class 2 boxes. So you can see here's the shape here. And the nice thing is the one side does not cut. So if I have a little conservative area where the adjacent tooth is not prepared, I'll basically use this to prep the little slot really conservatively without having to worry about damaging the adjacent tooth if you're trying to prep a conservative slot. And essentially what I do is I use a KS0 diamond, prep the outline of my slot without breaking the proximal enamel and leaving it just kind of thin. And then I go in with this sonic instrument to create the finalization of the prep. And it breaks the proximal enamel, creates the outline form of the box without having to worry about damaging the adjacent tooth because the outside of this does not prepare. It's a smooth shape. The rest of it's diamond coated. And I do have a video on my blog. It's called Product Recommendation Video 2. It was from December 2013, so a couple of years ago. And this video talks about ultrasonic preparation tips and shows you some video of using those tips. And I've used these tips for, geez, probably 13 years. Since I took a course with Pascal Magne, he was the first person I saw sharing using these tips. And I really liked what he showed, so I went out and bought them, and I've used them since. And they're very good for precision types of preparations. So I use these tips. I've created a video of this. That video is also available on YouTube if you look on YouTube. And then I also had a post quite a few years ago, about 5 years ago, about plumber's tape in dentistry, and it just showed some of the other uses that we have for plumber's tape. The most common use is probably just using it as an isolating medium to isolate. In this example, I'm isolating adjacent teeth as I'm bonding in 2 veneers at a time for this patient. So it's good to isolate adjacent teeth so you don't etch them when you're etching the teeth that are having the veneers. Another use that I have for this that I'll add as a little bonus to this video is I'll roll up the plumber's tape and I'll use it in the abutment of an implant over the screw head before I either cement the crown, if it's a cemented crown with a custom abutment, or if I have a screw retained implant crown, we'll torque the screw onto the implant and the crown onto the implant. And then, you want to seal that then with composite resin, but you don't want to get composite resin clearly over the screw head. So the way I used to do it is put cotton pellets in there. But I found that those I just didn't like the way they looked if you ever go in for a re-entry, and they kind of get stuck to the composite resin, and I just found it kind of messy. So I've found for the last 5 years, maybe 5, 6 years, we've put plumber's tape rolled up into those spaces, and then we put the composite resin on top of that. And if I ever have to re-enter, I find it's just cleaner and easier to remove the plumber's tape, etc. So another use for plumber's tape, it's actually a very useful product that we can have in dentistry. And another thing about this video, if you have uses for plumber's tape other than what I've shared in these simple uses, I'd love to hear about it. Make a comment below this video, either on my blog or on YouTube or even on Facebook, and let me know your uses for plumber's tape, because I think it's an awesome product. And as I said, here are some pictures. You can get it in different thicknesses. I like the thick one for certain cases as well. So this is 2 packages. These were $1 for 79 cents for the small one. I think $1.99 for the thicker one. Here, I took a picture in the hardware store. You can get these in the plumbing section of the hardware store. So it's called Teflon tape. And, you know, $2, $1. This package of 5 was $2.99. So, you know, this will last you a long time. It's the best value in dentistry of any product we would use, because it's from the hardware store. And then I saw this one when I went in this week just to buy some packages to show you how it looks packaged from the hardware store. And this one's called gasoline tape, or gasoline seal tape, gasoline thread seal tape. I'm wondering what this is like, so I'm actually going to use this in my practice in the next few months. And I'll let you know if it's any different or if there's some advantages to playing around with this gasoline version. I'm assuming it's thicker. But don't buy it. I'll let you know if I see any advantages to this as opposed to the simple Teflon tape, or thread seal tape they call it. This one was $4.79, so it was $5 Canadian. So it's a little bit more. Still great value in dentistry. I don't think there's much we can buy for $5 as dental materials or products. So thank you once again for joining me for this dental excellence video. And just remember, you can do this kind of dentistry. I believe that beautiful and precise dentistry is not just for the gurus. You can do this kind of dentistry. So thank you very much, and I'll talk to you soon. Take care.